wash my hands, and then verify healthcare provider's orders. So I have my MAR. The patient's name is Sleepy White. Her ID is 369121518. Her date of birth is 1660. Her allergies are Tigan and tetracycline. So it is 1600. So the healthcare provider has ordered for regular insulin 100 units per 1 ml to be given subcutaneously, PRN, every 4 to 6 hours based on fingerstick blood sugar values. Her fingerstick blood sugar was 220. So according to her fingerstick blood sugar, the sliding scale, we're going to give 4 units because it's between 201 and 250. And she was last given a dose at 11 o'clock, so 4 hours has passed because it is now 1600, so it is safe to give her. So I'm going to get everything I need to prepare. No mid-math is necessary because we have our sliding scale insulin, so just double check it twice. So you'd want to look again. The fingerstick blood sugar at 1530 was 220, which is between 205 and 250, so according to the scale, we will give 4 units. And the correct time has passed, or correct amount of time has passed, so it is okay to give her. So I'm going to get everything I need. So we have her insulin, we have tape, a pen, and an insulin syringe. So my insulin syringe is intact, unopened, and does not expire until April 2018, so it's safe to use. And then our regular insulin, we have regular insulin 100 units per 1 ml, which is what the patient or the doctor ordered, and it is intact, unopened, and does not expire until 2020. So I've already washed my hands, and I need a few of these. So you want to open this, clean off your medicine top. Leave it there just so that you know that you've cleaned it. Go ahead and open your syringe. You want to get this moving just so that it makes it easier to get it to where you want it. So we're giving 4 units, so I'm going to put it at 4 units. Then remove this, take off the top, and you inject your 4 units of air into the vial. Flip it upside down. Now you're going to draw up a little bit past what you actually wanted so that you can get those air bubbles out. Okay, so it's at 4 units. I've gotten my air bubbles out. Remove this and do your one-handed recap. And then you would show your instructor. So you go and show your instructor that you have 4 units. Okay, so this is trash now. Now you want to get your tape ready so that you can start to do your med checks. So we have the patient is, set this out of the way so you don't want to do anything to mess it up. So we have Sleepy White as the patient's name. On hand you have regular insulin, 100 units per 1 ml. You've prepared regular insulin, 4 units. And then you're going to give it today, which is 9/13/16. You're giving it at 1600, and my initials are AL, UK student nurse. Okay, so then you put that on here, put that on your syringe, and now you're ready to do your first med check. Okay. So we have the patient's name is Sleepy White. Their ID is 369121518. Date of birth is 1660. Her allergies are Tigan and tetracycline. we are not giving her either one of those. Ordered, the patient or the doctor has regular insulin, 100 units per ml. We're giving it subcutaneously. Based on her fingerstick blood sugar of 220, we are giving 4 units, or I'm giving it now at 1600. In my hand, I have Sleepy White, regular insulin, 100 units per ml, which was intact, unopened, and doesn't expire till 2020, so it's safe. We have prepared regular insulin, 4 units, and we're giving it now at 1600. We're giving it subcutaneously. Appropriate time has passed, which is 4 to 6 hours, so it's safe to give. Now we're going to do my second med check. So we have Sleepy White, ID is 369121518. Date of birth is 1/6/60. Her allergies are Tigan and tetracycline. We're not giving her either one of those. Ordered was regular insulin, 100 units per ml subcutaneously. PRN queued for 6 hours based on fingerstick blood sugar, which hers was 220, so we are giving 4 units. We're giving it subcutaneously. We're giving it now at 1600. Okay, so the last dose was at 11 o'clock. We're giving it now at 1600, so 4 to 6 hours has passed, but it's safe to give. In my hand, I have Sleepy White, regular insulin, 100 units per ml. It is intact, unopened, and unexpired. I prepared 4 units. I'm giving it now at 1600. The last dose was at 1100, so it's okay to give. Enough time has passed, and I'm giving it subcutaneously. So now you need to gather everything that you need to go into the patient's room. So you have your alcohol wipe, your pen to document on your paper MAR. Take your MAR and take this for your last med check, and your gloves. Okay, so now I'm ready to go into the patient's room. So I will knock.
Hello.
Hi, I'm Adrian. I'm going to be your student nurse today.
Hi, Adrian.
I'm going to give you your insulin. Is that okay with you?
Yeah.
And then you wash your hands. Can you tell me your name and date of birth?
Sleepy White. I don't know my birthday.
1/6/60. Okay, so I'm going to check the MAR. It's Sleepy White, 1/6/60. And I'm also going to check her ID band. Her number is 369-12158. On the MAR, we have 369-12158. So it matches. Can you tell me where you are?
I'm at the College of Nursing.
Can you tell me what month it is?
September.
That's correct. And can you tell me what season we're in?
We're in summertime, almost fall.
Yeah, that's about right. Or football season. Okay, so I'm going to come over here because we'll have to adjust the bed. Okay, so I'm going to go ahead and do my third med check at the bedside. So we have Sleepy White, 369-121518. Date of birth is 1/6/60. Her allergies are Tigan and tetracycline. We're not giving her either one of those. Ordered was regular insulin, 100 units per 1 ml, subcutaneously, PRN every 4 to 6 hours based on fingerstick blood sugar. Hers was 220, so we will be giving 4 units. Her last dose was given at 1100. It is 1600 now, so it is safe to give it again. In my hand is Sleepy White, regular insulin, 100 units per 1 ml, which is intact, unopened, and unexpired. Regular insulin, 4 units is in my syringe, and I'm giving it now at 1600 subcutaneously. Okay, so I'm going to uncover the patient. I'm going to go ahead and put some gloves on. Is it okay if I give it to you in your belly?
Yeah.
Okay, so that's what we'll do. So I'm going to go ahead and use my line markings to find the area. So do your 2 fingers, and that's the spot I want. This area has no evidence of bruising or inflammation or redness. Does this spot hurt?
No?
No? Okay, well that's a great spot then. So you want to go ahead, leave your finger there so you know where it is. Clean it. And then once you've cleaned it, just leave it there so that you know that that's where you cleaned. And Taylor, you're about to fill a stick and send it in like a dart. You want to pinch up 2 inches, and because you can do that, you're going to give it at a 90-degree angle. So 1, 2, 3, stabilize it with your non-dominant hand, then send it in with your dominant hand. Put it back on the barrel, move your hand to pull it straight out, and safety clap it. And then put it straight into the sharp since it's in the room with you. And does that feel okay? She said, yes, it does. You can put that back on there if it's bleeding or anything. Apply pressure. She's not bleeding. I'm going to take my gloves off. She says she feels good. I'm going to take this and put it in the trash. I'm going to cover her back up. Put the bed rail up. And I have to come over here to let the bed down. Put the bed back down. And then wash your hands. Then you want to come over here and document that you gave 4 units of insulin at 1600 with the finger stick blood sugar 220 is already documented, and then you put your initials.